You may or may not be familiar with the term brief intervention, but this strategy can be a factor in dramatically altering behaviours.
I think it's important that health professionals recognise people who they're coming into contact with who are continuing to smoke, who are admitting to having fairly heavy alcohol consumption, because what you can do is you may not be making a difference to their problem tomorrow, but their problems in 7 to 10 years' time, you may be making a massive impact to. So even brief interventions can get people on the right path and stop a problem that's there and potentially going to give them significant trouble in their years to come, early and promptly. And when you look at the majority of people who do have problems in their throat, alcohol and smoking, are contributors, and be that whether you're just a professional speaker, be that you're somebody who has acid reflux disease, all of these things are still made worse by smoking and drinking. So if we can help people cut those down, and we're relying on those frontline health professionals to do that, then we may be able to actually make an impact and improve the health of our local population, which is what the Look Ahead Cancer Campaign's been wanting to encourage and support since its inception, and that's to get people to present early, but equally to contribute to the work of other professionals in getting those contributory factors cut back and preferably stopped.
Brief interventions must be done well. If not, they can be counterproductive. Redcar & Cleveland Primary Care Trust Health Promotion Team demonstrate the point most effectively.
A brief intervention is a plan for working with individuals to assist all types of behaviour change, including stopping smoking and reducing alcohol consumption.
Brief intervention is a one-to-one approach. It's delivered within normal contact time. It should be used to assess readiness for change, and it's about using any opportunity to raise awareness, share knowledge, and plant seeds about modifying behaviour to improve health. A brief intervention can take anything from 30 seconds upwards, normally between 3 to 10 minutes.
The first scenario you're about to see demonstrates how subtle language can create confrontation, disengagement, and raise barriers with the client without us even realising it. When the scenario finishes, pause the DVD and consider the questions to see how you felt the session went.
Hello, how are you?
I'm okay, thanks.
Okay, well you're here for a checkup. I need to gather some information. One of the questions I need to ask people is, do you smoke?
Yeah, I do.
And how do you feel about that?
Well, I have been trying to stop, and I've cut down from 20 fags a day down to 5.
Well, that's great, but it'd be better if you could stop altogether.
Well, I have been trying.
I know it's hard. Look, let me give you this leaflet. It contains tips on stopping smoking and the number of the local Stop Smoking service, and they can offer you further support.
Yeah, okay, thanks.
The mentor gave praise, smiled, appeared genuine, displayed good body language, and she gave advice and information.
We have all these positive things about the mentor and agree that she's a pleasant person. Please pause the DVD and consider the following questions.
The mentor lost the client when she suggested quitting altogether. The next role play is exactly the same, but with a slightly different approach.
It's intended to demonstrate skills that explore a client's ambivalence, and it avoids giving unwanted advice and information.
Hello, how are you?
I'm okay, thanks.
Okay, so you're here for a checkup. I need to gather some information, and one of the questions I need to ask people is, do you smoke?
Yeah, I do.
And how do you feel about that?
Well, I have been trying to stop, and I've cut down from 20 fags a day to 5.
Right, and how's that going?
Oh, I'm finding it really hard.
What is it that you're struggling with?
Well, I've been smoking since I was at school, and it's just part of my life.
What's your favourite cigarette of the day?
The first one in the morning before I start getting ready.
So it starts your day.
Yeah, that and coffee.
Is there anything about smoking that you don't like?
I don't like the kids seeing me smoke.
So you're worried it sets a bad example. Is there anything else?
I've started to worry about my health.
I can give you the number of the local stop smoking service if you want.
No, I'd rather not.
Okay, I can see that you're thinking about some of the negative effects of smoking. If you ever want to talk it through, please call.
Okay, thanks.
Please pause the DVD and consider the following questions.
It went right when the mentor asked the client how her cutting down was going, and that led to the rest of the discussion.
Did you notice there was no praise in the second scenario? Praise, if not done properly, can be patronizing. Clients want people to listen to them. They want to be able to tell their story. Everybody's story is unique to them.
So, whether a person wants to change or not, we need to find out why.
Helping someone to stop smoking and reduce their alcohol consumption will undoubtedly improve their life chances.
There's good evidence when people stop smoking that within a period of time their risk factors start to fall off. It takes quite a number of years for the effects of the smoking to start to disappear, but you can turn the clock back, as it were. And we actually see on the clinics quite a lot of patients who got early changes, displays of these early changes that are warning you they might be getting cancer, and with patches inside the mouth. When they stop smoking, when they stop irritating those tissues, the tissues, you can see them starting to return to normal. So it is well worth encouraging.
So, be it noticing the early signs, signposting the need for help, or encouraging a change in lifestyle, you can be crucially instrumental in saving lives.
I think it's very important for all healthcare professionals to be aware that there is an increased incidence in the northeast of England of head and neck cancers, mouth cancers, throat cancers, that if patients come to them or if they have contact with anybody who's starting to complain, they say they've got some symptoms, they've got something that they're worried about, to respond, to actually just think, does this person have a cancer or a pre-cancer of the head and neck region?
I think what encouraged me to take the first step with looking into this is the conversation I had with a nurse who happened to be a friend when I remarked I had this slight lump, and it was only a very slight lump on my face then, and she pushed me.
It's important that the whole health community recognises that we can't do our job without your help. We need you to be the eyes and ears working with the community, looking for the early signs of head and neck cancer, and then getting people to follow the appropriate referral pathway to their GPs, to their general dental practitioners, so that those who require attention can ultimately end up with our teams so we can help them and manage them further from there. We need your help.